Well, good morning. I want to welcome you to this meeting this morning. I'm going to welcome Governor Noem here. First, I'd like to say something about our task force. Some of them are here. We started a task force where our city commission and our county commission started in March, probably the middle of March, so we've been going at it for quite some time. And there's some people here that were very instrumental in that. One is Denny, who's standing right next to me. I'm looking for him. He's right here. And former Mayor Paul Albert is here, too. These two individuals were our leaders for the longest time, right up until June 8th, actually. We held our own at 21 positives for about 4.5 weeks. And then all of a sudden, as of today, we'll probably be well over 500. So it's not going away. We got a lot of work yet to do. I can only assure the governor that with the COVID-19 recovery funds that she's bringing to our community today, I can only assure her that as a task force commission in our city and our county commission, we will dutifully stay within the lines with the funds, and we're very grateful for bringing them to us. We have needs for it. And so with that, I also would like to thank everybody for coming. And with that, I bring you.
Great.
Oh!
Nope, that's good. Thank you.
Somebody, I knew I should have done that.
No, that's good. Thank you.
Governor Noem?
Well, thank you, everybody, for coming. We really appreciate it. I'm joined today up here by Mayor Gary Harrington, also Beetle County Commission Chair Dennis Drake, and then, of course, Sheriff Doug Solem. So I appreciate their leadership throughout the last several months, and all of you in this room, too. I know you spent a lot of time taking care of this community, this county, and it just means the world to us and to the state of South Dakota that we have gotten through difficult times and done what we can to protect public health, but also make sure that we're providing for families the ability to still put food on their table and get an education and still be able to keep a roof over their heads. So I know you all have been through some ups and downs, but the tenacity of this community just means the world to me and to the state, and we appreciate the partnership. Now, the state of South Dakota received $1.25 billion from the federal government as a result of stimulus bills that passed through Congress. And it is the responsibility of the state of South Dakota to make sure that those are spent responsibly according to guidance that we get from Treasury, and to make sure that we're accountable for making sure that it's used for COVID-19 relief. So what we're doing today is announcing that $200 million of that is going to be the first batch of dollars that goes out to cities and to counties to help them with some of the costs that they've incurred. So the city of Huron today will be receiving $3 million that they will be able to use to help with COVID-19 response. So costs that the city has incurred taking care of people, maybe with shelters that you've put up, with personal protective equipment that you've purchased, emergency care, public safety, law enforcement, all of those costs that you've incurred to take care of folks, that will all be eligible for reimbursement. Now, the $3 million is the cap so far, and you'll have to send in, there's a link on the covid.sd.gov website that you'll be able to click on and submit those costs, and they'll be eligible for reimbursement up to $3 million. The county of Beetle will be eligible for $1.2 million. And that is the same process for them that the county will be able to facilitate. And again, it's for COVID-19 costs and public safety costs. And this should be incredibly helpful to making sure your budgets stay somewhat in line, especially in light of the fact that we've seen decreased sales tax receipts come in at the city level. We've seen it at the state level, and to make sure that we're prepared for the future. I've been reminding folks that we're not done with the virus. It's going to be around here for a long period of time. I'm anticipating that we'll feel the effects here in South Dakota for years. We may not be dealing with people getting sick for years, but we will definitely feel it by the impact our businesses have felt, that our cities have felt, and that we've got businesses that did receive some dollars from the federal government in stimulus checks. People and families received dollars into their pocketbooks, and that's helped us for the first few months, but that's going to wear out pretty soon. And the strain that they feel will certainly be felt long into the future. So this is an initial amount that will come forward to help the city and the county. And again, The city of Huron will get about $3 million of eligible expenses reimbursed, and the county $1.2 million. And then from there, we also have other dollars that South Dakota will be allocating, but we're going to be focusing as well on those costs that may be incurred into the future, and also some small business relief. Our small businesses are really struggling, and so we're looking at different programs that may need to come forward to help them get through these difficult times. Now, we have guidance from Treasury that is telling us how to help cities and counties today. Any new program that we would stand up, we need some legislative input on. And legislators will weigh in on what that will look like when it comes to bringing some relief for families or small businesses into the future. So we'll appreciate their help. There may be an occasion for a special session coming up in the coming months. But in the meantime, that's why I can't give you all the answers of how the full $1.25 billion will be spent today. But the legislature will be weighing in on those issues as well. And again, the state of South Dakota, our state is the one that will be responsible for making sure these dollars are spent appropriately. I'm the one who gets audited if the money's not spent appropriately. So that's why we're doing it in this manner, to make sure that those reimbursement costs are submitted on the covid.sd.gov website, and then we will then reimburse the city and the county for those costs after we deem that they're eligible according to the guidance that we've received from Treasury. And Treasury's been good working with us to give us some flexibility. They still have not given us any flexibility on replacing revenue loss. So I'm guessing the city has seen some decrease in revenue coming in because sales tax may have been impacted. But we will continue to advocate for that, because that'll give us some flexibility to make sure that we're not making huge cuts over on one side of budgets. Meanwhile, the $1.25 billion is sitting there that we can't utilize. So we're continuing to work with them, and we appreciate their help. But with that, why don't we let the chair of the commission speak a little bit, Dennis, about your budget, how it's been impacted maybe, and how this will be helpful, and then we'll have the sheriff talk specifically to his costs. I know that public safety costs, law enforcement costs on the county side and city side will be eligible for reimbursement, and that'll be a huge help as far as going forward as well. So would you like to say a few words?
Okay. Yeah, our costs are could be quite a bit more, but we got so many volunteers that have graciously stepped up to the plate and done a lot of that kind of work that we need. We do have a lot of costs from having our different departments do a lot of things that our volunteers can't do. But we've got a resourceful county and city here, and everybody seems to step up and help when we need it. So we didn't really expect this kind of money to come our way, and I know we'll do justice on the way we spend it. Doug, you want to say something?
Well, I feel that I played a pretty small part in this, but the biggest deal is the volunteers that we've had for our COVID-19 task force. What the school system has done here in Huron as far as stepping up and offering meals to the people in need. And also, I'd like to give a big thank you to the car chiropractic for what they've done, and the other doctors that were kind of shut down at the time and started our testing site. About all I've done is provide security for that. And, things have changed in our jail with our 24/7 program, our UAs and all that. So yeah, we have felt some effects on the costs or expense of that such too. But Huron came together and they did a great job with their COVID-19 task force.
Yeah, I just can't commend you enough for the team that you've all put together. And when you had your first cases, it was amazing to watch the community put together a task force that responded to take care of people. So I've kind of bragged about you all over the state, wherever I went, because I was impressed that you saw a challenge, but you stepped up and dealt with it and worked with the Department of Health and with our office to make sure that people had what they needed to do the best that they could. So we will be forever changed by the virus. We've lost people that we love dearly, but it is also something that I think if we can focus on some of our blessings as well, it'll help us get through the coming months in the best manner possible. So let's open it up to any questions that you may have for us, and we'll go from there. Quiet group. Okay, so what we will do is, if you go on the covid.sd.gov website, there is a link right there where the city and administrators and the county administrators will be able to click right on there and see what's eligible for reimbursement and immediately start submitting that and getting reimbursement as soon as possible. And Liza Clark, who is my Commissioner of Bureau of Finance and Management, will be conducting phone calls and conversations with those folks so they know how to do that appropriately to get as much revenue out here as soon as possible to be helpful. Okay? All right. Well, thanks so much. Enjoy your day, and I'll stick around for a little while in case you had questions you didn't want to ask in front of everybody. All right.
Say, Governor Noem,
Yes.
I'm Dr. Joe Carn. Just with the testing center, we've kind of talked within the healthcare community, and you probably may not know the answer, but just to relay it back, I know it's statewide. We're wondering once fall, winter hits, when we start our influenza, our strep season
Right.
again, do you think it's going to be a scenario where we may be not only testing COVID, but we might be in those testing centers doing a quick strep and doing an influenza test? And if so, you know, it's great the state, especially for Huron, is covering the cost of that, because, I mean, what's beautiful about Huron is we're all friends in this room, and what's beautiful is, as Terry Nebelsack and I have talked multiple times with teaching with the community, the unconditional love this community has for each other is just
Yep.
unbelievable. So when we get these patients in there, being able to offer them the best we can at the time. So do you foresee us doing those 3 tests? And if so, is it something that the state will pick up the cost of all that, or will have to kind of bill insurance? Do you have any input on that, or can you at least send that back and figure it out?
Yeah, typically the protocol still is with healthcare providers that you would test for those before you test for COVID-19. So you rule those out before you use, because there still is limited resources nationwide on testing capabilities. We don't have enough to test everybody in the nation every week or 2 weeks, which is why they test for strep, they test for all those other viruses typically before they test for COVID. So I think those protocols could change as more production of necessary testing supplies increases. But all of that has been eligible for reimbursement from the federal government through legislation, and they are talking about another package going through Congress. I'm not sure what that'll look like yet. There's a lot of debate going forward, but I'm sure that it will continue to address having those types of resources when we need it. And everybody is anticipating we'll continue to see an increase in active cases when we get towards the fall and winter. And so we're planning for that. And our Department of Health still has folks in an emergency operations center capacity working every day to make sure that we're prepared for that season as it comes. But I just want people to be clear. I anticipate, originally we thought with no mitigation measures, we'd have up to 10,000 people in the hospital on our peak day that would need elevated levels of health care from COVID-19. And because everybody took it seriously and stayed home, practiced good hygiene, washed their hands, did all the activities that they did, we dramatically reduced that number. I don't anticipate that we'll see a spike like that, but we will see waves. Across the state, we will see increased cases. They will go down again, and we need to be prepared for that. That people will get infected, they'll get the virus. Our job is to protect those that could end up in the hospital. They could threaten their lives. And so that's why the vulnerable population, those that have pre-existing health care conditions that could get them very ill, those we still need to be very stringent on what we expose them to. We had some conversations earlier about, activities and events going on in the state. The state fair will look very different this year than it has in the past. It's important to our state, it's important to this community, but I have directed my Department of Agriculture to take measures to make it look different and to protect public health. So there will be different activities, there will be social distancing implemented, there will be different things changed to make sure that we are protecting the public while they come out and enjoy something that's an incredible part of our history and our heritage. And we'll be communicating with all of you on those plans going forward. But in my viewpoint, we are not done with what we need to do to address the virus. And we all need to stay diligent on that, even though I think overwhelmingly the public wishes it was in our past. They would love to just go tomorrow and have things get back to how they've always been, but we're going to be smart about how we approach this and protect people that need it.
Okay, thanks.
Yep. Terry.
Terry Noble, second
Yep.
school. Governor, the third leg of this, they don't get to hear, but I think it's important for them to know everything you've done on the education side. We've had 900 new iPads delivered through the ESSER fund so that every child K-12 is ready so that we can come in and out of school, one classroom at a time, and that large schools in particular, and then the Huron area schools are very supportive of the latitude you've given us because it's going to be different parts of the
Right.
state. And they also need to know about your staff's initiative to try to get connectivity to the people who can't afford it. That's as big a part of the picture as everything, and I just wanted to thank you from people.
Oh, absolutely. Then that's going to be a challenge, is getting our kids back into an educational process which benefits them and their well-being. And that's been the biggest challenge in the state. I don't think people realize that when kids were sent home because of the virus, we lost track of 20 to 30% of them. That means their parents didn't follow up with us once, they didn't check in, they didn't do any homework, and that indicates to us a lack of accountability, that we wonder if those children are in a safe situation and if they really are being adequately taken care of. So that's why it's important that the school has the ability to check in with them, to be engaged with them, because it's not just for their educational needs, it could be for their social needs, their welfare, to make sure that they're doing okay, they're eating, they're being well taken care of. So, but I'm still pushing hard on getting broadband to every corner of the state, and we're limited a little bit by what our telecom companies can put in a year, because all this money has to be spent by the end of 2020. So we can't hold money over and spend it for the next several years. What they've given to us has to be spent, and so we're going to use it to connect as many kids as we can to technology, to get them opportunities to be educated in different manner. But our telecoms, we're going to have to ask them to step up and work hard to get that infrastructure put into place, because if we have the resources now is when we need to make big strides to make it happen. But every school district will be given the opportunity to educate their kids in the manner that best suits them, their buildings, how spread out the kids are, and to have that kind of flexibility. But they do know that it's my desire that we connect with those kids physically in some way, so that we know for sure that they're being taken care of and that their needs are being taken care of so they can be successful. Anything else? Now, there is dollars that have come to South Dakota that aren't a part of the $1.25 billion. There was a lot of money that went to our tribes separately. It went directly to them to help them with COVID-19 expenses. Education, the K-12 system, those dollars went right to the school districts and to K-12, did not come through the state of South Dakota, and then higher education did receive dollars as well. So even though the $1.25 billion is there, and it's in the state, ready to be dispersed to cities and counties and small businesses, there is other funds that have come to the state as well, and some of that is money that Terry was referencing. Any other questions or comments? Okay. All right, we'll stick around. Have a wonderful day. Thanks for all your help. You guys have been awesome.